Happy Monday. So we're gonna allow folks to trickle in. I know it's just turned 2 p.m., but we will let we'll give folks maybe like 3 minutes. I'm sorry I do not have music for you all. Unfortunately, it's that kind of Monday. So in the chat, I guess while we're waiting for folks to come on in, if you want to go ahead and share your name, your pronouns, organization/role, as well as a question, an icebreaker question to be answered in the chat is, what kind of pasta would you be? I got that from Anna Marson over at LGBTQ Center OC. And they said I am more than welcome to use that as an icebreaker question. And I thought it was so fun. Some of the answers were very cute. And then I'm gonna go ahead and I'll introduce myself, and then I also want to make sure that Lou as well as Ariela get the chance to introduce themselves, since we'll all kind of be some of the co-facilitators for this particular meeting or webinar. So thank you all for joining us on this Promising Practices, Queer Folks in Tobacco Prevention Media Advocacy. I'm happy to see you all here. I am the program coordinator for Out Against Big Tobacco Los Angeles. My name is Jess. My pronouns are she, her. And we are, the program itself is housed at California LGBTQ Health and Human Services Network. I know it's a mouthful, but I kind of wanted to give that little background. And then Lou or Ari, if you wanted to go ahead and share.
Yeah, I can go ahead. I'm Lou. I go by he, they pronouns. I am the network organizer for the HHS in short terms for the long-winded abbreviation that Jess gave. And then in terms of pasta, I feel like I would be angel hair pasta because they're so thin and I'm like really small. So I feel like I relate to it. I'll go ahead and pass it over to Ari.
Hi, good afternoon. My name is Ariela Cuellar. I use she, her pronouns. I'm the senior communication specialist for the network and also assist Out Against Big Tobacco LA. Yeah, happy to be here. I'm not sure about a pasta. Maybe just spaghetti because I feel like it's pretty versatile, and I feel like, yeah, I can definitely jump into multiple different hats. So I would say that.
What is it called when we prescribe like human traits to food? Anthropomorphize? Is that the word? Yes, I love the anthropomorphication going on. Okay, I'm gonna go ahead and get started. Well, actually, before I do, hold on, let me move my Zoom stuff because it's kind of blocking my, okay, there we go. So I want to go ahead and do a land acknowledgement, just making sure that we are paying respect to elders, both past and present, and are grateful for the opportunity to live and work on these ancestral lands. We hope to demonstrate our commitment to truth by honoring the land on which we gather, which is the occupied territories of Tongva, Tataviam, Serrano, Quiche, and Chumash peoples. And that's specific to LA County, just in case folks weren't aware of that. So today we're going to be going over kind of really what this webinar is meant to kind of produce for folks who are joining, is how to kind of grab the attention, engage queer communities, queer folks in this type of work. We understand, as my director likes to say, Danny Cesenia, sorry. They like to say that it's not necessarily the sexiest issue, but it's definitely something that's important. So we're going to go over kind of the agenda, I guess, is what it's looking like, is a quick context. I do want to talk a little bit about big tobacco and the history among kind of LGBTQ plus communities, also understanding tobacco use as a public health issue. And then we're going to go over, if for folks who did kind of read the blurb, a public health framework, which is called the Health Equity Promotional Model, and kind of how we're going to utilize that in order to produce resources. And again, just engage queer folks in ways that really highlight some of the issues. And again, hopefully this, helps folks who are trying to figure out ways, creative and innovative ways to, again, engage queer communities in the work that they do. And then lastly, Ari's going to go ahead and present on the communications aspects and tying it all together and what that looks like. And I don't necessarily have personify. Yeah, okay. I don't necessarily have my eyes on the chat. So Lou, or if y'all would help me with that. If anyone has questions, anyone wants me to clarify something, yeah, feel free to type that in the chat. But yeah, if you can help me with that, please. So big tobacco, I feel like in a lot of these tobacco prevention spaces, we talk about big tobacco, and I say that I kind of use my hands because I don't, if I'm being honest, a lot of times I didn't necessarily know what that, I didn't know what that meant or who we're referring to. So I kind of wanted to make sure to give that breakdown to you all. So it usually refers to the 6 largest tobacco companies. Over the years, these companies have repeatedly been a topic of controversy for the products they produce and the tactics with which they sell and market them. So tobacco use is still the leading cause of preventable death and disease in the United States. Despite a general increase in, or decrease, sorry, in cigarette use in the United States, there has been no change in the use of smokeless tobacco, which may also cause cancer. Some of the tactics utilized by these companies have been noted to be similar to that of other industries throughout, kind of American history, such as the oil, sugar, cell phone industries. Ultimately, these companies are controversial due to the negative health effects, and have been, that they produce, and attempts to misinform the public on this topic. So in the United States, the big 6 companies have worked together to conceal scientific evidence on the negative effects of tobacco. There's also a well-known history, right, of manipulating and destroying evidence, and also kind of with Project Scum. I'm not going to get too much into that, but I know that, again, in other spaces, that these are kind of the go-to examples when we're talking about, again, that dark history related to big tobacco amongst the LGBTQ plus communities. So the 6 are China National Tobacco Company, British American Tobacco, Altria, Philip Morris, R.J. Reynolds, Imperial Brands, and Japan Tobacco International. So just some quick context in terms of targeted marketing and limited cultural competency. These are just some advertisements that I was able to kind of come across. They're filled with subtle and not so subtle LGBTQ plus imagery and messaging, marketing, and less. So kind of some of the, I guess what I wanted to talk about in terms of targeted marketing was that they were targeted in that they were very intentionally placed in different kind of retail outlets. Something called the head shop is kind of so kind of similar to a smoke shop in that sense. Again, very strategically placed so that they are targeting very specific individuals. That first picture is an example of marketed targeting. You can kind of see the, it's, what's the word I'm looking for? Kind of alluding, there we go, that's the word, alluding to just the type of language, the ultimate stud, orally fixated, kind of this different language use. That second picture is a picture of Billie Jean King, who was a lesbian activist and tennis star. They were announced at the time as a Philip Morris board of director, and they played a direct role in kind of that Virginia Slims product from the Philip Morris company, the big tobacco company. And Virginia Slims, again, like the actual kind of cigarette, had a strong presence in the lesbian community and media. Also, that tour, again, very much like very publicized kind of, the LGBTQ plus community in that way in terms of highlighting this particular athlete. Pictures 3 and 4 were very strategic, or 3 and 4 as in, sorry, I'm like, reading my notes here. But Get Lucky, the taste that starts with, the taste they stay with. Again, kind of this just, LGBTQ plus representation, but again, obviously for very negative reasons. And then this last picture, a drag queen, and then, a person right next to them. Also examples of very strategic marketing examples that exemplified big tobacco's predatory practices among what was considered taboo communities at the time. One marketing firm stated that this is a dream market, that them referring to kind of the LGBTQ plus community, also said, quote unquote, attention starved and very loyal community. So kind of getting the big tobacco companies at the time really kind of honing in on kind of what they felt that community wanted, desired. So yeah, definitely just wanted to kind of go over those marketing strategies in that way. The only thing with that, though, is that we understand that Big Tobacco did a very good job of, again, targeting this particular community. But the issue today is with public health campaigns, they have not always been competent in creating messaging that resonates with the LGBTQ plus community. So obviously these were predatory in that they were marketing them in a way for the sake of, well, not the sake of, but ultimately detrimentally affecting their health because of, tobacco use is well known to have negative effects. But at the time, right, it was just people were so misinformed. The information was just not clear. And today, while we understand that tobacco use is a public health issue, I feel like, well, not I feel like, but I'm pretty sure a lot of us feel like the messaging is not quite tailored in a way that helps us, again, understand this information to its fullest now that we know that the effects that tobacco use has. Another kind of aspect I wanted to talk about is, again, kind of ending on that note of being like, attention starved, right? So using the industry attention as validation. So this picture that I have included here says companies that care. Sorry, I wanted to go ahead and read what it said kind of in that text there. But it says America's best companies can't put a value dollar on diversity, but they recognize the importance of it nonetheless. They know there's inherent value in a workforce that reflects all the characteristics of the communities they serve, and they know that treating all customers with respect is good business and good corporate citizenship. The companies that follow illustrate many different approaches to diversity. Some stress philanthropy, others focus on diversity in hiring, and others concentrate on understanding and meeting the unique needs of minority customers. Whatever the approach, each of these companies has decided to demonstrate its commitment to gay and lesbian Americans by speaking directly to us in companies that care. So you can see that Philip Morris is the first highlighted company. Other companies also mentioned included the Kodak, Microsoft, Chevron. These kind of corporate social responsibility tactics serve to cultivate positive perceptions of the industry and undermine tobacco prevention efforts. Other strategies, again, for the sake of industry attention as validation, included funding for LGBTQ plus organizations and making campaign contributions to LGBTQ plus identifying politicians. Both organizations and individuals accepted these contributions without fully recognizing the health hazards of commercial tobacco use. But again, with just all the misinformation at the time and not necessarily it being considered a public health issue at the time, that's how we see, again, kind of the history or the trajectory that we would later see. So tobacco use now as a public health issue. By the late 1950s, evidence on smoking and lung cancer called for public health action. The Surgeon General was among the first kind of authoritative figures to address the public health implications of smoking. I think I mentioned here, oh no, I actually didn't mention in the actual slide, but there was a 1964 report that was released where there had been several kind of statements, both from the Surgeon General, different groups of public health scientists, and the report was Royal College of Physicians, and essentially it identified cigarette smoking as a cause of lung cancer. And these reports were based largely on epidemiologic studies, which is a field of public health. So I have here the cigarette century, and kind of this is the time where we really start to see that, the negative health effects that came along with tobacco use, smoking, kind of really unfold. So Congress did enact legislation to educate consumers about the hazards of smoking. And that's kind of how we start to see this, like, these, little notes, I guess, on the cigarette packs themselves, may be hazardous to your health. That was very significant at the time because that's when we first start to see these different, actual information being led by scientists. And now I don't think I have a picture. I didn't include the picture, but we kind of see an actual note from the Surgeon General on the different, on the smoking packs or the cigarette packs, is that it does cause cancer, right? There's a direct cause for that. So you kind of see, again, just going from not acknowledging any of the negative health effects to ultimately now we start to see all kinds of messaging on the products themselves. So So why is tobacco use considered a public health issue then, and not just an individual issue? An estimated 30 million people quit smoking in the decade following that 1964 report. Different organized programs to help people quit smoking, such as the 5-Day Plan, had gained popularity. And by 1970, there was a $50 million a year of industry for profit smoking cessation programs. So now we start to see a lot of kind of funding for the different cessation tactics, but programs, and kind of how, again, we start to see this shift of actually acknowledging from very big public figures that tobacco use is then a public health issue. And again, the negative effects that come with that. And I wanted to include this quote here. The major difference between tobacco dependence and other drug addictions is that it's tobacco is a social acceptability. So again, that social norm or that normalization around smoking, especially within the LGBTQ plus community. So with that quick context, and if folks have questions, please feel free to type that in the chat, come off mute. But now I kind of wanted to introduce this idea of the health equity promotional model. So again, it's a public health framework that allows us to examine LGBTQ plus mental and physical health by acknowledging the full range of contexts and experiences, both adverse and positive, that may influence individuals' opportunity to achieve their full potential. So my background is in public health, and kind of the different frameworks that we utilize is in order to identify an issue, a condition, especially like a health condition, right? This particular model highlights the importance of understanding how historical as well as individual life events and environmental factors, being social, political, economical, physical, cultural, all these different environments influence health and well-being. So it's pretty simple here, though, at least the one that I included here. So kind of seeing it in a chart here, life course is kind of just that in the field of public health, at least it's the trajectory of kind of the way your life unfolds given these different contexts, different events, different life factors. And we can kind of categorize that in a couple of different ways. So psychologically, socially, behaviorally, as well as biologically. And ultimately how the social positions that we each have and the different identifiers, kind of alluding to like intersectionality in that way, impacts our health, our overall health and well-being. So a quote I included here, and again, kind of just like adding or giving you an example of that historical / environmental context. Here I included many queer elders came of age when same-sex behavior and gender nonconformity were severely stigmatized and criminalized. So obviously that kind of contributes to overall life events, especially considering the era. So this is definitely more of like a detailed kind of example of the health equity promotional model. And so kind of the different 4 sections or sectors that I kind of want to look at is these social positions at the top. So whenever we look at this equity promotional model, again, it helps us identify issues and the communities that those issues impact. I think I said that the opposite way. The communities that the issues impact. Sorry, there we go. So kind of looking at that first bullet point, social positions, and again, this is alluding to intersectionality. Most health research has ignored the diversity within LGBTQ plus communities without exploring how LGBTQ plus health is differentiated by social position. So this can be sexual identity, gender identity, race, ethnicity, age, again, all these different intersectional identities. The health equity promotional model demonstrates combinations of these social positions that are oftentimes associated with types of marginalization. So the thing about the equity promotional model versus something like the minority stress model, though, is that this model does really try to emphasize the positive or the room for kind of potential to be positive, right? So kind of also acknowledging the strength, resilience, different opportunities that folks also might, encounter whenever, again, we're trying to identify the issue. We also want to make sure that we're not necessarily just focusing on the negative. And then 2, kind of this first level here is, again, that historical and environmental context. So we want to, when we're identifying a group that we want to shed light on, a community that we want to shed light on within the LGBTQ plus community, we want to kind of look at the different structural level context as well as the individual level context. So this can be kind of like viewed as, at least structurally, also like systems of oppression, right? So kind of like, again, not the individual level, but more of like the institutional level versus individual levels, things like microaggressions, discrimination on the individual level. Microaggressions, for example, have had a significant impact on LGBTQ plus individuals' health. Health injustice occurs both at the societal and institutional level. So just again, also acknowledging these different factors helps us ultimately, for example, we're using it here in a different context for the sake of creating and engaging queer communities, but this can also be used to like, identify issues for the sake of policy or laws. And then this third aspect or third section, I guess, that I want to focus on is called health promoting and adverse pathways. So LGBTQ plus adults report disproportionately higher levels of adverse health behaviors, including higher rates of smoking, drinking, and substance use, which are all leading causes of preventable death. When we consider adverse health behaviors, there's a lot of kind of research being done and virtually none in other areas, especially as it relates to like the different communities within the LGBTQ plus community. Socially, the effects of relationships with others on health have been widely documented in the general population, right? Kind of, not necessarily focusing on the LGBTQ plus community. Social network size and type influence health outcomes, but we all know social networks differ between queer folks and the general population. Queer individuals often develop chosen families, meaning extended networks of partners and friends, with less reliance on legal or biological family members. So again, kind of that support network looks differently, right? In comparison to the LGBTQ plus community and outside. So again, these different health promoting / adverse pathways might look differently for the LGBTQ plus community. And then ultimately, how these different contextual factors ultimately impact our health, both physically and mentally. So when considering the different boxes, right, those first three different sections, ultimately we're trying to identify the different health outcomes that these other issues might produce, especially as a result of these first three sections. So I know that's kind of a lot. I know it's a mouthful, but in this next slide, I do kind of pinpoint a particular issue using this health equity promotional model for the sake of creating meaningful community engagement. And what that means or what I'm trying to get at here is that it really helps us us doing the work in tobacco prevention, really pinpoint a particular issue with whichever kind of community that we're really trying to focus on for the sake of highlighting, again, the different physical and mental health outcomes. So for this particular example, I am using well, I guess not everyone here might know, but currently Out Against Big Tobacco, my program is trying to create a document that focuses on asexual folks, or also known as ace folks. So I kind of want to give a quick context for folks who are not necessarily familiar with the exact definition of asexuality, or may not necessarily be familiar with kind of what the community is about. So just understanding asexuality, ultimately, ace folks experience little to no sexual attraction to others, or low or absent interest in or desire for sexual activity. So asexuality is not celibacy, absence until marriage, or waiting for the third date. So just kind of, again, that background on what asexuality is and who ace folks are. And that's kind of the A in LGBTQIA acronym. But again, kind of going back to just kind of the equity model, promotional model itself. So understanding the historical environmental context that I want to highlight when talking about ace folks and the ace community. I specifically chose queer exclusion and ace phobia. So kind of what that is, again, trying to kind of define what these terms even mean. So ace folks might experience ace phobia, which is the hatred of and discrimination against asexuals, whether through active targeting, casual gestures, and rhetoric or otherwise. They may also experience social or queer exclusion. I know here specifically I outlined social exclusion, but that presents itself as queer exclusion sometimes too within the community itself. So among LGBTQ plus activists, there is a history of lesbians and gay men dismissing bisexuals, transgender people, and other gender and sexual minorities. Exclusion is often based on the notion that certain gender or sexual identities are more legitimate or natural than others, both being individual level context. So that's kind of what we're focusing on for the sake of creating this document that we want to share with other folks. And kind of looking at that middle box for health promoting and adverse pathways. So the behavior that we obviously want to highlight as a part of this program is tobacco use. But that kind of forces us to look at, well, not forces us, but I wanted to look at the different ways that might affect family structure. Again, how are we even looking at norms? So LGBTQ plus individuals may not face physiological infertility. And again, looking at that family structure where I say social infertility, but often need fertility treatments or donors. That's what's referred to as social infertility. So I feel like that was something that not necessarily a lot of people knew about, or again, didn't even realize there was kind of like language to discuss this topic. But ultimately, it highlights the family building needs of LGBTQ plus parents, promoting awareness and access to care. So while social infertility sounds like it might have a negative connotation, and it does in many ways, right? It does also acknowledge the fact that there are different ways to build families within LGBTQ plus communities, and that's kind of the health promoting pathways, right? In that way. Also acknowledging the different norms for ACE folks, especially as it relates to, for example, pleasure. So ACE folks are part of the LGBTQ plus community. Like other LGBTQ plus identities, asexuality is diverse, with people experiencing a wide range of romantic attractions and relationships. So ultimately, when we're looking at this, kind of what the health outcome it produces, we want to focus, or I at least wanted to focus on the sexual and reproductive health. So again, highlighting how that might be, how again, sexual health encompasses overall well-being, not just the absence of disease, and is expressed through diverse sexualities and expressions. It is significantly influenced by gender norms, roles, and power dynamics. So considering sexual orientation differences, tobacco use may reflect expressions of, sexuality, again, throughout kind of the, again, acknowledging that historical context, and ways to cope with queer phobia, ace phobia, queer exclusion, social exclusion within the community. So I'm gonna go ahead and stop there and take a little breather. But if folks have a question, you're more than welcome to come off mute or put it in the chat. But yeah, kind of just focusing on these different sections for the sake of, again, identifying a particular issue. That way it helps you kind of build, whether it be a resource, a webinar, again, really just engaging folks in very strategic and intentional ways to kind of, again, highlight whatever issue it is that you might be interested in at your program. So I did want to have a little interactive activity. I know that was a lot of words said by me. So I just want to make sure that folks kind of have an opportunity to also maybe utilize this health equity promotional model for the sake of just starting to, brainstorm ideas, again, ways to pinpoint very particular issues, especially as it relates to tobacco use within the LGBTQ plus community. I think, Lou, if you don't mind dropping the template in the chat, that would be really helpful. So this template is going to allow folks to be able to kind of work with the model directly. And again, be able to kind of plug in. We have different kind of terms that you're able to plug in. Or again, if you want to just kind of use your own for the sake of, being able to utilize this maybe for your own resource, or maybe, again, a particular issue that you're trying to highlight in your own program. So hopefully folks are able to download that and write in it. We were having some issues with being able to actually, get into the document, but I think it should be okay now.
And just to make sure y'all can see the file I shared in the chat, correct? Cool. Awesome.
So I'm wondering, I'm gonna go ahead and go back here. And I did want to kind of, let folks come off of mute and kind of maybe, talk about a particular, again, like identity, or maybe there's a particular community within the LGBTQ plus community, or maybe even outside, again, of the LGBTQ plus community that you might be thinking of right now, that you might already be working on. Kind of just wanted to gauge folks, yeah, maybe what, if, someone wants to kind of share with us maybe what they're working on, or all of the above. Or again, maybe folks are not necessarily working on something right now, maybe a previous time where they, maybe kind of how they can, again, like plug in some of the issues that you've tried to highlight or shed light on throughout your work. And maybe you found that, or maybe you didn't have a model like this, and kind of like, what was your way of brainstorming those ideas to ensure that you're being intentional, you're acknowledging the different kind of historical context with that particular community.
I just wanted to add in an important note, I guess, about intersectionality and thinking about all of our identities, those of us who identify as queer, and thinking about what that means and how that is different for each and every single one of us. Um, and so, yeah, it's something that's coming to mind, especially when thinking about community engagement, because oftentimes we think about big labels for entire communities of people, Latino or Black or Asian, and those big labels are made up of so many smaller identities, so many communities. And same thing with the LGBTQ community as well. There's so many letters in the alphabet. And, we each have our unique things to bring to the table. And yeah, this conversation wouldn't be complete without that.
Thanks, Adam. Appreciate you and your intentionality on, use of language. Yeah, so I guess I'm also kind of curious. Maybe we can kind of help build this together, one by one. So maybe if folks kind of are interested in a community like that they're wanting to work with, maybe don't see enough resources on kind of how to engage this community, maybe we can kind of start there.
Um, I guess like if you're looking for communities, like I think maybe one might be LGBTQ plus people with disabilities.
Yeah, okay, so thank you for that, Ryan. So if we're kind of considering, LGBTQ plus folks with disabilities, kind of understanding the historical and environmental context, just wondering if any folks are kind of interested in like the, disability justice and kind of what that looks like, and maybe how that's been different throughout history. And again, that's not necessarily my forte. So again, if folks are out there who kind of have that, knowledge, that would be helpful whenever we're, again, I'm trying to understand the historical and environmental context. And that's kind of part of it, right? Is like really trying to find like, stakeholders who can answer these questions, who can help us understand the historical and environmental context, doing the research ourselves, really understanding again what this community has kind of experienced throughout time, in the US. So yeah, just wondering if there are any folks out there kind of who would say that they have that knowledge. Ryan, I'm curious, since that sounds like a community that you might be interested in, like, supporting in that way. Just wondering if I don't know if there's anything maybe you can share with the rest of us in terms of like historical and environmental context.
Yeah, I mean, I think I mostly brought up that community just because like it is a community that I'm like wanting to learn more about how to like support and stuff like that because I'm able-bodied. So um yeah, I mean, I think in recognizing that like maybe at least for the purposes of the activity, like maybe one that the group is more familiar with might be like at least good to try filling out this like form. You know what I mean? So like
Yeah, so and I can also say too, like using that form, right? Like I know ableism is on there, so kind of like understanding institutional ableism on a structural level and how that might affect LGBTQ plus folks with disabilities, right? So that's kind of how we start to break this down. Really looking at how that manifests, right? Like in our everyday lives. And maybe that's something that we're not acknowledging. And then Ari put in the chat, also a reminder that not all disabilities are visible. Yeah. So
yeah.
again, yeah. So kind of again, if that's what we want to acknowledge and like shed light on, maybe not necessarily physical disabilities, that's again another way to really pinpoint on the issue.
Yeah, I mean, I guess like an example of ableism might be just like um not giving folks like ASL translation services during like events and whatnot. So like I think a lot of people think of that. I think for a lot of people it's kind of an afterthought. So I think like in terms of maybe for the historical and environmental context, um at least piece that I see like it might just be again not having like proper services maybe as kind of like a parallel to like queer exclusion.
You're muted, Jess.
Oops, sorry. So I'm gonna go ahead and share the document and maybe we can start to plug in these, these different things that we're discussing. Again, just to kind of see what actually utilizing the model might look like. I'm about to do that. Okay, so can folks see my screen?
Yes.
Okay, awesome. So I'm gonna go ahead and type in LGBTQ plus folks with disabilities. Nope. And the structural level, right, that we were talking about is kind of that institutional ableism. And Ryan, you had mentioned, sorry, I think the services not having, I'm can't remember what you said, sorry.
Yeah, just not having like inclusive like services or programming. So like an example of that would have to be like kind of ASL translation being viewed as like a second thought. So I think that'd be social and yeah, like a lack of ASL translation in like community events, for instance.
Yeah, so part of this is like, kind of because this middle one acknowledges both health kind of promoting and adverse pathways. So you can kind of see it either way, right? Like the lack of ASL translation, or do we want to emphasize, having ASL translation at these, events or whatever it might be. And ultimately, that way we're kind of just like going through this like in a more kind of simplistic way, but what kind of health outcomes might that produce if we're considering, having the ASL translation? Obviously, like the accessibility is being met, right? So actually that'd probably go under, well, I guess it would go under both, right? Physical and mental health, but definitely, also adhering to like physical health for sure.
I also do feel like it promotes a sense of like visibility and like in a way like acknowledgement of disabled folks and kind of like making them feel that there is space for them in these kinds of topics and in that way.
Yeah, no, yeah, for sure. So in the document itself, we do have like kind of like a boxes of terms kind of where you can again start to, if you hadn't necessarily thought about these different kind of structural level like levels of discrimination or systems of oppression, kind of like allows you to plug this in and really think about like, okay, well, how does that manifest with whatever particular community that you're trying to focus on. If it's whether LGBTQ plus folks with disabilities, for example, we're working kind of like or trying to highlight more about the ACE community. But again, like how might, again, social stigma, heterosexism might play a role in those different kind of structural level oppressions. And then we have like here we know for our particular resource we use tobacco use, kind of like a generalized term, but you can break it down to smoking, vaping, e-cigarettes. I know that different folks in the space are kind of working on a particular kind of product, within the tobacco, kind of like, different tobacco products, I guess. So kind of like how might you be able to switch that out, and for the behavioral part of this framework. And then ultimately, I know also other folks are kind of working on different intersections, maybe, LGBTQ folks who have HIV or, folks who might have cancer. And again, we're talking about disability. Oh, I don't know what happened to my little document here, but yes. So ultimately, really, really just kind of honing in on pinpointing what it is that you want to highlight, depending on the different social position that you're wanting to talk about, and kind of including maybe it might be a resource or, again, whatever it might be that you're working on. But, okay, let me go ahead and go back to the presentation itself. But yeah, ultimately trying to kind of find that intersection where public health and engaging folks and kind of that space in between or where they meet, right? Really utilizing these different frameworks so that it helps your program. Okay, can folks see the presentation again?
Yes.
Awesome. Okay. With that being said, I'm going to go ahead and pass it over to Ari so that she can talk about the communications aspect.
Yeah, thanks, Jess.
Oh, sorry. Hold on, let me share again.
That would be great. But yeah, that was actually a really great transition into like some of the next information I'm going to be sharing with folks and just how to actually engage LGBTQ plus folks in tobacco prevention. But I think a lot of these like practices that I'm going to go over can definitely, resonate to whatever specific community or demographic you're also wanting to engage. In case you weren't already aware, big tobacco doesn't, impact every community equally, as you just saw earlier too in the some of the earlier slides just presented on, they really do a great job in targeting their marketing projects to various groups, LGBTQ plus communities included. So yeah, although it's not the most pressing issue, it is definitely one that impacts us. And that's why, unfortunately, you see something like this visual here of like this question of when did smoking become a part of us? And that is, due to a lot of that historical marketing that we kind of shared earlier. But yeah, if you could go to the next slide. I wanted to also highlight just the importance of creating content that is effective and engaging. And some of that includes, culturally relevant and engaging content, campaigns geared specifically for LGBTQ plus communities, and also incorporating, some storytelling aspect to it, making it more of a personal experience, also highlighting intersections and experiences that identities have. So I did include here some screenshots of our fact sheet that we're currently working on finalizing regarding tobacco use and asexual desire. And that this education material actually spurred from the idea of like, oh yeah, maybe we should create like some type of education material that's around tobacco use and, its impacts on like sexual desire. But then, we were reminded that that's not always innate for many folks, including the asexual community. So we wanted to create a document that kind of highlights the different intersections of tobacco use, sexual desire, and also including LGBTQ plus inclusivity in there. And then I also wanted to highlight this graphic we used to help promote a spotlight on posts that was written by Jessica and also our previous Out Against Big Tobacco intern Victoria, that highlighted, kind of the unpredictable or like unlikely intersections that tobacco use has, and connecting it to the show Sex and the City. So that's why you see Samantha here with the quote that says like, but holding on to those nasty cigarettes, well, that's just whack. I highly recommend folks to check out that blog post. I believe it's still on our website. If folks, or maybe Lou, if you wanted to drop that link. Yeah, it just kind of helps to highlight some of that messaging with the direct, relation to some of these fun, engaging ways that we can bring tobacco use in to our spaces that folks find more relevant and engaging. So yeah, I also wanted to highlight some key messaging strategies that we have used in the past. So I feel like nowadays most folks are, very aware that tobacco use is, bad for you. And so we're kind of avoiding that direct messaging and highlighting some more uplifting messages. So on the screenshot to the right, that was one of our social posts that highlighted just like some of the health benefits of after a month to 12 months of quitting smoking for up to like 1 to 2 years, and just like dropping those, main takeaways that like, instead of always highlighting like the negative impacts of smoking, just kind of empowering folks, and whatever step or pause that they do take from tobacco is definitely a win. So yeah, like even 1 to 2 years of quitting tobacco after quitting tobacco can definitely lower the risk of heart attack drastically. So, I feel like it's also important to highlight these, these key messages, because we often want to connect, like the main message with the values that our community holds. So that's another example that I have on the right that shows like more geared towards like the environment, not only putting for yourself, but putting for the planet, to help highlight the environmental impacts that tobacco has that many communities, I feel like, are, active and continue wanting to advocate for, to make it, to make that connection and reasoning for the advocacy even stronger. I also highlight or suggest, forming any subcommittees to help consumer test these materials or messaging, just to also, make sure that community voices are included and uplifted in whatever communication messaging that you're trying to create, especially engaging LGBTQ communities and either co-creating them or testing them. So that way, ensure that they're relevant. And we also do try to provide a stipend to folks for their time in reviewing materials, because I know it can be a lot to, read all the information and also provide that feedback. So that's also something I encourage folks, if you're able to do, providing that stipend to folks who volunteer their time and helping to make these materials even better. Next slide, please. So yeah, meeting community where they're at, I feel like is super important. You always want to, ensure that the look, feel, messaging takes into account, like I said, like the cultural norms and values that each priority population that you're trying to reach, has. So for the Out Against Big Tobacco Coalition, at least, we've, definitely been engaged with folks in person spaces, and of course, like online as well. So you can see that screenshot of Jessica presenting at Orange County's LGBTQ plus advocacy day event earlier in June. Also providing that collaboration invitation to folks to apply for our request for proposals and subgrantees at that event, which is, nice, because it's not always that we get to be in those in-person spaces. So whenever you can, that's a great way to like make connections or even get folks engaged in the work that you're doing. Also tailoring the content to reflect the, unique experiences of LGBTQ plus folks, I think, is important. Again, our previous intern, Victoria, wanted to highlight some of the impacts that secondhand smoke has in our pets. Because a lot of LGBTQ folks do have fur babies instead of real babies, and, highlighting that, how, that reasoning, that connection, and grows that, like that value of like ensuring not only your own health is prioritized, but like the health of your fur babies and everyone involved in, your unit is also taken into account. And, provides some really, kind of eye-opening facts in that social media campaign that we released earlier this year. And then also, leveraging any community influencers that you may know of at local events, or when you're trying to disseminate information. So that's a screenshot of a video that we had Chad Michaels, who's a famous drag queen, do for us a couple years ago to help promote a survey that we were doing for the We Breathe program. And so she even went on to share her own personal experience with tobacco and nicotine addiction, and highlighted how important it is for folks to get engaged in filling out the survey, so that folks can just be more at the forefront. And that definitely influenced our policy platform that we also created for the We Breathe program a couple of years ago. So, these are just some examples of, how you can meet your community, but of course this varies from population to population, and I'm just mostly focused on the LGBTQ plus community here, but always open to ideas and stuff. But yeah, just wanted to highlight those. All right, and then distributing materials can look very different depending on your own organization's capacity. We like to, of course, have things like flyers and toolkits available if we're at like any tabling events. Ensuring that the materials are, of course, accessible in plain language, ready for, both in-person and digital use. So you'll see there that we have incorporated some, QR codes on some of those flyers for folks to easily like take a photo or snap that link and share like those materials more widely. Also making them visually appealing. I know it's hard to get folks, engaged in tobacco work, but if there's like a fun graphic or like some colors that make it pop, I think that's also, something to take note of, and, make it reflective of the community that you're trying to reach. So yeah, always having printouts available, or even like some giveaways is nice to get folks engaged. And also that helps us build like our own listservs. It helps us build our own following on social media to help increase our reach, and also, stay engaged with other communities or organizations that might be doing similar work. So that kind of also goes hand in hand with meeting, community where they're at, just promoting, wherever you can and however you can is also super important, and a large part of a lot of this advocacy work, because sometimes, you can be saying and developing the greatest message there is out there, but if it's not being heard, or resonating with anyone, it can just feel like you're yelling into the void, which we never want. So yeah. Next slide, please. So yeah, you always want to have a call to action that oftentimes we've resorted to empowering our communities with the call to action, whether it be getting help with your quit journey if you are engaged in, or if you are participating in tobacco or nicotine use, and kind of reclaiming that narrative that we don't have a choice and that tobacco will like forever hold a dark a dark hold on our communities. But we definitely see those efforts being combated here by encouraging active involvement and leadership in tobacco prevention, that both the Out Against Big Tobacco LA program and our We Breathe tobacco prevention program has various like leadership opportunities available. Also creating opportunities for feedback, like I mentioned earlier. We definitely engage folks in our consumer testing of education materials to have that ongoing participation and suggestions and voices being heard directly from community. And essentially we want to turn our awareness of our coalition, of the work that we do, into action. And so that could be getting folks signing on to petitions or joining our advocacy, joining the coalition, utilizing even like earned media that we've done in the past through like interviews and op-eds. I included this screenshot here from one of the interviews Jessica did I think last year, actually, yeah, last September, with a radio station that's local here called Pueblo y Salud. And she talked about the Out Against Big Tobacco program and more about what we do. And so that alone also helps to get folks more engaged, to see our presence out there in like local outlets, I think is super important too. But yeah, I think, or do I have one more slide? Okay, then I'll just say, I think it's always important to keep a close touch point with your audiences. I feel like there's never, like one single audience that we can create these messages for. So constantly being, checking the pulse and like keeping your radar out for any like relevant news or resources or like even statistics that, resonate with your community, I feel like is super important to highlight. You can always also use those to create, things like education materials or social media posts to also engage those communities more in your issues that you're trying to also highlight and gain that advocacy in. But yeah, I think that was all I wanted to touch on. If folks have any questions, please feel free to reach out to me, or also happy to take those now. But yeah, I'll also leave my email in the chat if folks wanted to dive in deeper later.
All right, I have
a
question. I have a question actually. More because so there's kind of a reason why we separated the format of the presentation itself, but since I have power of the slides, I'm gonna go ahead and go back to this particular slide where you leverage community influencers. I'm kind of curious, and maybe other folks are curious too, I'm assuming that involves like having a budget allocated for that, or is that like kind of what does that process look like?
Yeah, that's a great question. I feel like you don't always have to provide, or like you don't always have to rely on the budget to garner those community influencers. Sometimes your own organization is that influencer that has garnered like the the trust of other organizations or people that they're trying to engage with. So sometimes it's could be an ask and see like if they're able to just do that for free. In this case, we did have extra budget, and so we reached out, and I believe this was like done on Cameo. So it's a platform where you can essentially pay folks to, say a PSA. So that's what we utilized here. But, I think community influencers also don't have to be like famous. They can be your own, people that you see in these spaces that you're trying to engage more of and bringing them into the conversation. Like I think I would probably, categorize like Shannon Kozlovich, who we've worked with pretty closely, as like a community influencer that has definitely left her mark in like the tobacco prevention world. So That's just one example, but yeah, I hope that answered your question.
It does, thank you.
Oh yeah, and thanks Lou for dropping my email in the chat in case any other questions pop up or unless anyone has something else that came to mind.
In the meantime, I can go ahead and close us out. Looks like we'll be finishing before 3:30. But yeah, so kind of in order to engage the queer community in tobacco prevention work, while this is not meant to be an exhaustive list at all or comprehensive, and kind of understand, especially as it relates to maybe your own program and kind of the different areas that y'all want to focus on, but just kind of a starting list in that way. So one, valuing engagement as a core public health practice. For those of us who, really kind of honing in on the tobacco related health disparities part, that does involve like public health work. So kind of understanding, or not understanding, but interpreting engagement itself as a core public health practice. Two, sharing power with communities. So understanding and recognizing the history behind a certain issue. That really allows folks, like not just ourselves as like kind of the people on the program itself, but also really helps folks like, more of the general population, and again, the communities that these particular issues impact, really recognizing the history, the historical context that comes with that. That's really, I feel like that's really important when understanding something like as a public health issue, but also, ensuring that folks have kind of that information to be able to recognize these different issues. Three, building trust first. So involving these different stakeholders, trusted members, organizations. And I think that kind of also goes hand in hand with what Ari was talking about in terms of communications, like as far as, leveraging that kind of community, those community influencers. So really just, maybe a community influencer that might be known for a particular kind of like, maybe they already have their own I want to say like I guess advocacy going on within a particular community. So yeah, really building kind of that trust in ways that you find would really speak to the communities that you're wanting to speak to. Four, using language that values community. So obviously language is ever changing. So really ensuring that with whatever kind of language that you're wanting to highlight, knowing kind of the historical context that might come with, especially as it relates to LGBTQ, different communities and the communities within. And then lastly, what Ari was talking about, just really emphasizing those action-oriented practices. Awareness is kind of one aspect of, highlighting the different issues, but ultimately like these more action-oriented practices will really allow us to kind of get that engagement that we're looking for, but also, tackling those problems and issues head on. So go ahead and just leave that up for a second, but yeah, do folks have kind of questions about maybe the different practices? Hopefully, these are maybe, some different practices that folks hadn't necessarily considered. Well, not hopefully, but, if it's something that you hadn't necessarily considered, hopefully it does kind of help you in creating that engagement within the different communities that y'all are working with, especially within the LGBTQ+ community. But that's where we end, folks. Kind of just have my, contact information. We do have a QR code for folks who are wanting to kind of be on our newsletter, Out Against Big Tobacco Los Angeles newsletter. Specifically, folks might already be on the network newsletter, but we do have a separate newsletter for Out Against Big Tobacco. And then Kaya, who's our new program intern, wanted to leave their information there as well. That's another good way to be able to contact us, reach us. Should I miss an email? God forbid. But yeah, go ahead and leave. Folks have questions, comments, concerns. But that's it from us, folks. Thank you.